administering your medication via Minibag. There's an INT in place. There's nothing infused. It shows the primary. So I am going to assess the doctor's orders, make sure it's for the correct patient, the medication, the dose, the amount, and the frequency. And I have my doctor's orders here, and the doctor ordered vancomycin for the patient, so I will assess the lab value, so I'll just make sure the white blood cells count is elevated and any allergies the patient may have. And the doctor ordered 2 grams, and what we have available is 4 grams per ml, so that comes up to half a ml of medication, and it'll be infusing for an hour. And the drop factor is 10, and so the drop rate would be 8 drops per minute. And so now I would wash my hands and put on my gloves.
And a number of attempts, as well as any instructions that I gave the patient. I'll just calculate the minutes. Looks good.
Okay, and now I would administer my medication. And so I have my 0.5 ml that's already drew up of my vancomycin, and I would insert it into my bag. Oh, it's right here. And so I'll put my 0.5 ml here. Okay. And dispose of my shots container, and I would swish the medication in. Okay, and then I would attach my tubing. Before I do that, I will label my medication bag with the name of the patient, the time, the time of administration, the dosage, and my initials. And then I would attach my new tubing and make sure the line is closed before I attach it to the medication. Okay. So my label is attached. Okay. So I'm going to hang my bag. My line is closed. Okay, the line is closed, and I'm going to prime my tube and squeeze the drip chamber. Squeeze, so halfway full, and then I am going to prime my tubing. Okay, so my tubing is primed, and I am going to label my tube with the date, time, and my initials, and then I am going to just put this here. Okay, and I'm going to I'm in the patient's room. I'm going to assess the IV site for phlebitis or any infiltration, and make sure if the patient has received the medication before, and if the patient has not received the medication, I'll explain the medication to him and what it's for, and I would clean my area, clean the INT extension, like so. Okay, and then, first I would do my ASASH procedure, so I would attach the syringe of it's 6 mLs already drew up, and so I will insert 3 mLs of normal saline, and I'm going to make sure this is open first, and I'm going to aspirate, make sure I have correct placement still, so I have a blood return. So I'm going to flush for 3 mLs, push, stop, push, stop, and I'm going to close it off with positive pressure, and I'm going to detach this and clean my area again, and then now I'm going to administer the medication, and this is still sterile. Okay, and I'm going to open this, and I have to establish my drop rate. which was 8 drops per minute. So I will do that now, slowly opening the clamp and looking at my watch. Okay, so the drop rate is set to 8 drops per minute, and I will let the infusion go on. And if the patient has not received the medication before, I will stay and exert the IV site for 15 minutes. Then I'll come back when the medication has run its course. So I have left. I came back, and the infusion is done, and so I'm going to close my line and check for any infiltration or phlebitis, so no swelling, no redness, no leaky site. And I am going to close this, well, detach this because my line is closed. And I'm going to attach an alligator clamp, so for next administration. And I am going to complete my A-stash. So I'm going to attach this, the syringe, and I'm going to flush with the rest of my 3 ml normal saline. Push, stop, okay? And then if the doctor ordered heparin, I would administer heparin for a PICC line or a central line. And so I have completed that, and I will close off the INT and make sure that the site is still in good condition, and I would dispose of all of my needles in the sharps container, and I will do hand hygiene, and I will remove my gloves, and then I would document the date and the time, and using my MAR, the drug, the dosage, the route, and the condition of the IV site, and the volume used to administer the medication for the MAR and the INO.